Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So there is a new report from the CDC that says people who have been vaccinated do not need to be tested, but for how long? Is that indefinitely?
Well, it's indefinite. It's indefinite. It's definite until they require a booster. So that is going to be somewhere, it looks like, between 8 and 12 months after being fully vaccinated.
I know there's a lot of parents that were concerned about getting their children vaccinated in the first place, but now we hear this story about a possible heart condition link. Talk about that and if it should be a worry.
Yeah, so far this is just the very first report. We don't even know how many cases there are, and there's probably more because now that the word is out, the doctors will be looking for it. But so far, just in the little report that we have, the cases have been mild. Now, this happens anyway. There's 10 to 20 cases of myocarditis per 100,000 population anyway, and it follows many viral diseases that kids get anyway. So we don't know if it's a cause or effect, just an observation or what. But even if it is, keep in mind how many children, it's almost 4 million children have gotten COVID, and 16,000 hospitalized and 300 deaths. And it's one of the top 10 leading causes of death in kids. So COVID is still much worse than any kind of a side effect like this. Even though it's a severe side effect, it hasn't been lethal as of yet anyway.
And this is something we keep coming back to, the Wuhan lab. What is your take on this report that the workers there were very sicker than what we thought?
Well, this story is never going to end. There is no answer to this story. They're never going to be able to prove something didn't happen. It's very difficult to prove something did not happen. It's easier to prove something did happen. That hasn't happened. So, we don't know. I mean, obviously more investigation, but, I really don't see this really going anywhere. It's just going to be another footnote in the whole history here. I mean, because let's face it, are the Chinese really going to let us do a huge, thorough investigation? I doubt it.
All right, let's get to some viewer questions. This person says, my 65-year-old sister refuses to get the COVID vaccine because it's experimental, but is very concerned about vaccine/COVID shedding from vaccinated individuals. Is this a valid concern?
This person's in a lot of trouble, this 65-year-old woman, because she's very much at risk for getting COVID and getting sick and becoming a long hauler. I mean, bad things could happen. The vaccines that are out there are not experimental. They are FDA approved under the Emergency Use Authorization Code that they have, EUA. So they're approved. They're just approved under this emergency use because it's a pandemic, and almost 600,000 people have died. So they are, both Pfizer and Moderna have applied for full approval, and that should be coming relatively soon. All the data are there. Over 161 million people have taken the vaccine. I mean, come on. Now, as far as viral shedding, that's another, I don't know where this person's getting their information. These vaccines that we have are not live virus vaccines, attenuated virus vaccines. There is no virus in the vaccine to shed. Doesn't happen. It's actually impossible. So there is no viral shedding. On the other hand, somebody who's unvaccinated who gets infected, they can shed the virus like crazy and even be a super spreader.
Gotcha.
All right, next question. I am fully vaccinated, but if I did get the virus, what are the chances of becoming a long hauler?
Really, really remote, because the chances you even get a symptom are low. People have gotten COVID after being fully vaccinated, but oftentimes they're picked up just on routine screening. They don't even have symptoms. They don't necessarily have to have symptoms. They can have symptoms, but it's usually very mild. They usually don't end up in the hospital even. And in most cases, the prevention from dying from COVID is 100%, almost 100%.
All right, next question. AMC has started up $5 Tuesdays. Is it safe to sit in a theater for 2 hours? I'm vaccinated, with or without mask. Should I do it?
That's a good deal. I like the CDC recommendation here, because they say if you're fully vaccinated, you don't have to wear a mask, and you can go indoors or outdoors without wearing a mask. Now, the city, the state, the county, the business, all these people can put in their own rules. But let's just say whether you wear a mask or not, or how far away you sit, you are safe. You can do these kind of things if you are fully vaccinated.
Gotcha. All right. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, doctor.
Thanks.